What we found is, well, actually what we set out to do was create a treatment care path or guideline for patients with non-small cell lung cancer, because we found that really within our institution and within some of the oncologists in our system that we worked with, is that there was a lot of variation in the, especially in the frontline chemotherapy regimens given for non-small cell lung cancer, and more particularly for the non-squamous patients. There was lots of data about different cytotoxics, and then with the use of maintenance drugs, with potentially using different maintenance drugs, either alone in combination, we found that docs were really doing a little bit of everything, and even the same doc was not treating different patients consistently. So we really wanted to use the data, not only the efficacy data, but think about toxicity, cost of some of these regimens, and create a path that hopefully would provide a guide to follow for most patients who present with non-small cell lung cancer, advanced non-small cell lung cancer. So our team of thoracic oncologists, we sat down, we looked at all the data for frontline regimens in the non-squamous setting as well as maintenance. We discussed it, and basically what we found was that the regimen that made the most sense clinically and from a toxicity standpoint and quality of life standpoint for patients was pemetrexed and carboplatin. So that really became our preferred regimen for these patients, again with non-squamous non-small cell lung cancer. And as far as a maintenance regimen for patients who benefited from that combination therapy, we also felt like pemetrexed made the most sense based on the efficacy data. So that was really the regimen that was going to be the main regimen to use for these patients. So once we got this care path together, it was basically communicated within our institution to our regional sites, posted on our intranet sites. Our chemotherapy our EMR chemotherapy regimens were kind of tailored down to use these, and was then tracked, basically with the help of some of our data analysts. So we looked at a baseline population over a 1.5 year period prior to the institution of the care path, and again we did basically the data that we got kind of confirmed our own fears, was that lots of different regimens were being used. Then when we instituted the care path, again very quickly, so within 6 months, we found that essentially all the patients who were treated with advanced non-squamous non-small cell lung cancer, 86% of them received the preferred regimen, which was pemetrexed and carboplatin, compared to, again, our baseline cohort, which was basically different regimens being given at 20 to 30% rates.